Here's a reality that should terrify every parent. America's childhood vaccination shield is crumbling, and our schools are about to become ground zero for preventable disease outbreaks. Educational institutions across the nation are witnessing a disturbing trend. Immunization rates among children continue their downward spiral, leaving administrators scrambling to develop emergency response strategies for what many health experts believe are inevitable disease outbreaks in classrooms. The situation has intensified dramatically under Health and Human Services Secretary Robert F. Kennedy Jr.'s leadership. His recent policy overhauls have sent shockwaves through the public health community. Kennedy made swift and sweeping changes, including the complete dismissal of all 17 members serving on the CDC's Vaccine Advisory Committee. Additionally, he orchestrated the removal of the CDC director, along with several other prominent HHS specialists who had previously championed vaccine safety and efficacy. But here's where it gets controversial. Kennedy also halted federal recommendations for COVID-19 vaccines among individuals under 18 years old, a decision that has created a firestorm of debate among medical professionals and parents alike. This year alone, the United States experienced its most significant measles outbreak in decades, serving as a stark reminder of what happens when vaccination coverage drops below critical thresholds. Facing this escalating crisis, 3 West Coast states decided to take matters into their own hands. Oregon, Washington, and California jointly announced the formation of a strategic public health alliance on Wednesday, specifically designed to combat vaccine misinformation and promote immunization awareness among their residents. The governors of these 3 states issued a powerful joint declaration. The CDC has transformed into a political instrument that increasingly promotes ideology rather than scientific evidence. Ideology that will result in devastating health outcomes. California, Oregon, and Washington refuse to allow our citizens to face such unnecessary risks. And this is the part most people miss. While some states are doubling down on vaccine protection, others are moving in the complete opposite direction. Florida made headlines Wednesday by announcing its intention to eliminate every single vaccine mandate currently in place throughout the state. Joseph Ladapo, serving as Florida's Surgeon General, didn't mince words when he declared, "Every single one of these mandates is fundamentally wrong and reeks of contempt and authoritarian control." Currently, school districts throughout Florida maintain vaccination requirements for a comprehensive list of communicable diseases, including polio, diphtheria, measles, rubella, pertussis, whooping cough, mumps, tetanus, and several other infectious conditions, requirements that mirror those found in educational systems nationwide. Lawrence Gostin, who holds the distinguished position of Global Health Law Professor at Georgetown University, painted a grim picture of America's immediate future. He predicts 3 major developments. First, we'll witness a continuous decline in childhood immunization rates across the United States. Second, we'll observe increasingly larger clusters of unvaccinated populations, particularly within religious communities, creating perfect conditions for major disease outbreaks that will spread with alarming speed. Gostin continued with his most concerning prediction. Third, we'll see a stark geographical division between Democratic and Republican states. Blue states will intensify their efforts to ensure comprehensive vaccination coverage for all school-age children, while red states will systematically remove vaccines from required lists and establish extensive religious and philosophical exemptions that will create massive gaps in their childhood immunization programs. The consequences of declining vaccination rates aren't theoretical. They're already manifesting in deadly ways. This year's measles outbreak, which originated in Texas, serves as a sobering example. The outbreak, characterized by a significant number of unvaccinated individuals, resulted in more than 100 hospitalizations and tragically claimed the lives of 2 children. Research published by Johns Hopkins University in June revealed alarming statistics. Measles vaccination rates among children decreased in nearly 80% of U.S. counties following the COVID-19 pandemic. This data underscores how the pandemic disrupted routine healthcare services and created lasting gaps in childhood immunizations. Lynn Nelson, who serves as president of the National Association of School Nurses, provided insight into the practical challenges schools are facing. Speaking specifically about Washington state, though I believe this situation mirrors conditions nationwide, our state Department of Health has already distributed guidance to schools outlining necessary preparedness measures. The reality is that outbreaks are likely inevitable. It's not a matter of if, but when they'll occur. Recent CDC statistics paint an increasingly troubling picture. Vaccination rates among kindergarten students during the 2024 to 2025 academic year continued their decline, dropping to 92.1% for the diphtheria, tetanus, and acellular pertussis (DTaP) vaccine. Similarly, coverage for the measles, mumps, and rubella (MMR) vaccine fell to 92.5%, as did rates for the polio vaccination. Here's a critical fact that many people don't understand. Achieving herd immunity against measles requires approximately 95% of the population to be vaccinated. With current rates falling significantly below this threshold, communities become vulnerable to rapid disease transmission. These declining immunization rates have created unprecedented challenges for school nurses as they navigate the beginning of each academic year. Nelson explained how this crisis has fundamentally altered their priorities. Immunizations now demand immediate attention in ways we've never experienced before. She elaborated on the traditional start-of-year responsibilities that nurses typically juggle. Our usual routine involves collecting medication orders, developing individualized care plans, and training school staff to handle various emergency situations involving students with chronic health conditions. Historically, while immunizations remained important, they wouldn't dominate our focus during those crucial first weeks of school. Nelson described how dramatically the situation has changed. Previously, the majority of children would arrive fully immunized. We'd identify those who weren't current on their shots, and then, once things settled down, we'd begin reaching out to those families. Now we're in a position where we simply cannot afford to wait. Immediate action is essential. Kennedy, who has maintained a skeptical stance toward vaccines for many years, has pursued an aggressive agenda since assuming control of HHS. His newly appointed CDC Vaccine Advisory Panel members have already voted to eliminate thimerosal, a mercury-based preservative that has been safely used in flu vaccines for a century. Kennedy and his supporters continue to promote scientifically unfounded claims linking thimerosal and other vaccine components to autism, despite overwhelming scientific evidence to the contrary. Under Kennedy's leadership, the federal government has also withdrawn its recommendation for COVID-19 vaccines among healthy children and revoked the shot's emergency use authorization, moves that have generated significant controversy within the medical community. The growing opposition to Kennedy's policies became evident Wednesday when more than 1,000 current and former HHS employees collectively called for his resignation through a formal letter. These healthcare professionals specifically cited his decision to fire the CDC director and other policy changes as compromising the health of the nation. Their letter stated unequivocally, "We firmly believe health policy should be grounded in robust, evidence-based principles rather than partisan political considerations. However, under Secretary Kennedy's leadership, HHS policies are endangering the health of all Americans, regardless of their political affiliations." When the Hill reached out to HHS for comment regarding these concerns, the department did not provide a response. Kennedy, who is scheduled to appear before the Senate Finance Committee on Thursday, where he will almost certainly face intense questioning about vaccination policies and the CDC leadership changes, has consistently maintained that he's not attempting to prevent anyone from accessing vaccines if they choose to receive them. In a recent post on the social media platform X, Kennedy outlined his position regarding COVID-19 vaccines. "I made 4 specific commitments. 1. To eliminate COVID vaccine mandates. 2. To maintain vaccine availability for people who want them, particularly vulnerable populations. 3. To require placebo-controlled trials from pharmaceutical companies. 4. To end the emergency authorization." However, public health experts argue that Kennedy's actions will inevitably contribute to further declining vaccination rates, leaving schools to bear the brunt of the consequences. Dr. Paul Offit, who directs the Vaccine Education Center and serves as an attending physician in the Division of Infectious Diseases at Children's Hospital of Philadelphia, offered his assessment of Kennedy's ultimate objectives. "I believe Robert F. Kennedy Jr.'s goal is to make all vaccines optional. In other words, to create a system where no vaccine receives official recommendation, but rather becomes part of individualized clinical decision-making between patients and their healthcare providers." He added a particularly concerning observation. "The ultimate goal appears to be the complete elimination of all school vaccine requirements." So here's the million-dollar question that every parent, educator, and community leader needs to grapple with. Are we witnessing a necessary correction of government overreach in healthcare decisions? Or are we dismantling a public health infrastructure that has protected generations of American children from devastating diseases? What's your take on this seismic shift in America's approach to childhood vaccines? Do you believe parents should have complete autonomy over vaccination decisions, even if it potentially puts entire communities at risk? Or do you think some health measures are too important to leave to individual choice? The comment section is open, and this debate is far from over.